So I look across both our health, local government, and care parts of the business, but I'm a technologist through and through. So I keep saying 20 years, but it's actually nearer 25 years. I'm just getting older faster than I anticipated. So technology for 25 years, and there's been a huge amount of change in those 25 years. And I'll come back to it in a few moments, but this is one of those moments. There's only been a few throughout my career, but this is definitely one of them that we're at the moment. And hearing the conversations about AI actually is a key part of that, but it's about how does that work as a complementary part to the individual that's providing that care. And Evo is all about that. Evo is about how do we complement those providing care with the tools and the capabilities to do things in the most effective way possible. So I'm going to start this with a video, which is a little bit cheating because it means I don't have to talk so long, but I'm going to start with a little video to give you a bit of an insight as to what Evo is. So yeah, when we think about Evo, Evo is not a product. So first and foremost, let me just put that out there. Evo is not a product. Evo is a capability. It's a capability that sits across our collection of products. And that's been delivered in multiple ways. And I'm going to go through these in a little bit more detail, and then we'll begin to put those into a little bit of context into the setting. So it's about a single place. So it's a single place that you can access all of the things you need. We talk about actually, so that's single sign-on to that in particular environment. And sometimes we overlook these little pieces, but actually single sign-on adds massive benefit. 20% of all calls to IT centers is about password resets. So if you can remove that and the security concerns of having multiple logons, etc. So that speed and efficiency to get into these tools, so 2 clicks to get into all of the software products that you have, makes it far more efficient. And then we have all of those products wrapped there, but then the ability to look at things like feeds, so having the feed of information that you need readily available to you when you want it, the Copilot access, so you can interact in a natural way with the products and services you've got and access that data and those insights in the right way. But also making that available in any device that you want to use. So we need to give that flexibility around accessibility. So how do we ensure that you can access all those things at the right time in the right places? So before we even get to that, we need to take a step back. And that is, it's great to do AI, and Alan talked about it, and Umang was talking about it as well, around ethical AI, but we need to approach it in the right way. And that's about taking a step back, and taking a step back to think about the 3 key things that we need to ensure we do, and we always deliver when we're looking at AI. And these are the 3 security kind of pillars, if you like. Firstly, it needs to be company secure. What I mean by that is it needs to be in a walled garden. It needs to be ring-fenced. The data that we put into these engines and we input needs to be secure. So it needs to be secure, and we need to make sure we're protecting that patient data and that information effectively. If we can do that, we can begin to interact with these tools effectively and make the most of them. Secondly, it needs to be permission aligned. The challenge when you begin to interact with tools is I can say, how much does someone else get paid? Where does so-and-so live? Now, you shouldn't have access to that data unless you already had those permissions within your existing products. So we need to wrap those to allow and ensure that the permissions you get from an AI perspective are the same as the ones that you would have had within the tools in the first place. And then finally, it needs to be personally private. So the reason for that is that you will interact and you will look at certain things within the policies that sit within your organization. That might be your notice period. That might be paternity, maternity policies. Those things are privately confidential to you as an individual. So those elements need to remain confidential. So as long as we maintain these three security elements, then we can ensure that we can open this up and allow you to all reap the benefits and utilize the technologies that sit there. So it's about it being private, keep that data secure and safe. It's about being controlled, and then it's about confidentiality. If we can maintain those three things, then we can allow these tools to be used effectively. This is a multi-year partnership where we're working together, because we need to help guide this as it goes, because this is moving at such pace. We need to work and understand all the different user cases and potential scenarios and pitfalls. So it's about working together in collaboration and partnership. So how does Evo work? So firstly, the most important piece actually is the button, because that's where everything lives. Everything that you want to interact with will live within the access button. So when you open that up, you have access to all of the different software products that you have purchased, but also you have access to your spaces and Copilot and feeds. So when we talk about Copilot, so I love the analogy of the pilot. I'm going to steal that and use it in future. But it's powered by Microsoft, and what it allows you to do is to talk naturally and input naturally into a tool that then allows you to surface information. So we're going to have a little play with this, but I always like the example, we use policies quite a lot. I've talked about it quite a lot in care as well, but it's the most boring subject. That's why, because nobody really goes in. It's a tick box exercise. It's just a collection of documents, and we ask for people to look at them. Whereas actually, if you can interact and say, I want to understand something, and it surfaced that information, and it's from your policies, then you know that it's accurate. And if you want to then have that information, you want it in a completely different language, you want it in Romanian, or you want it in Hindi, for example, you can ask that and it will summarize it then in that natural language for you. So then you're allowed to, you'll have the ability to consume that information quickly and readily anywhere that you are on any device that you've got. And it's pulling from your own policy documents that are held in a repository there. That also then links, because it allows you to then say, well, I might need some learning on that particular policy. You can add it to your feed, or you can add it to your learning program. That's where the feed comes in, because actually feed allows you to have those things that are really important to you there. So is it the latest dashboards? Is it the latest reports that you need that's pulling all that information from the various locations? But it's a way of having everything in one place. That will give you the back office things that you might need to do. Is there expenses to approve? Is there holiday requests? Are there learning modules that you need to complete? Or have you got members of the team that haven't completed those learning modules? That will all be surfaced in the feed. And it's then the ability to interact with those directly. So link straight into that tool to give them a notification, or to give a push, or to create that approval within the feed itself. So making things far more efficient. Having it accessible on lots of devices. It always feels like a little bit of a given now, but we've moved at such pace through how we begin to use more and more complex tools in a mobile environment. It was only 5-10 years ago, and actually the tools that you were using, not quite Snake on your Nokia, but it was a little bit more extreme than that. But actually the tools were really basic, and I think there were some interesting conversations earlier on around the simplicity of interaction with applications versus the complexity of the interactions with some of the software tools and that digital literacy piece. Actually, we need to give the ability to use these tools in so many different environments now, online, offline, etc., to ensure that we can give that capability to use them. And I think the other thing for me is we need to make it as easy as possible for people to interact and gain the support that they need. There are so many tools and questions that you have. How do we create and allow that accessibility to those things really quickly and easily? You want support. How do I get that support? First line is probably digital support, but actually it's about understanding What other support cases are there available? What other services have I got? Can I access my billing? Can I see what the latest billing and finances are that I need to check? Obviously aligned with your controls so you can still access those. But also following up on any support that you might need. So accessing the latest knowledge-based content, etc., surfacing that is absolutely key. So this is making some real shifts towards making it, you see a lot of the cards on the table. This is an AI-powered care companion. This is not we're not looking to replace the individuals. It's about complementing the individual to do more and more effectively. We see that with the effective use of AI, every individual can be about 10% more efficient and effective. And overall business operations can achieve efficiencies of around 30%. So there's huge opportunities, but if I take that step right back, you have to do it in the right way. So we've got a little bit of mapping this in another video, so I get to sit back for a second. But to begin to bring that into context of how you could use that from a day-to-day perspective. It's about how do we wrap these things together. So it's about how do we begin to think about the patients, the staff, the trusts, the ICS, the neighbourhoods. How do we begin to bring the things that they're trying to do together into ways of working? And it's wrapping all of that with Evo, because all of these different pieces will plug in. It's less about, I want these different dispersed tools. It's about having outcome capabilities that are all wrapped and you can interact with them in a consistent way, is the way that we will help drive and make those things more efficient.
Let's take a look at how the Access Evo Health Suite supports a typical day in the life of a mental health clinician, showcasing the various scenarios they encounter. The first step along this journey is the team briefing, a critical opportunity for the team to review urgent patient notes and discuss plans for the day ahead. Before the day officially begins, our clinician utilises the Access Evo app to review their appointments. When discussing these appointments with the wider team, clinicians benefit from a holistic view of each patient, drawn from multiple data sources. This ensures important events are flagged for review, saving valuable time by eliminating the need to sift through numerous patient notes. Now we move into patient assessments. Access Evo equips the clinician with tools that enhance the efficiency of these assessments. For example, Access Smart Notes records the details of a patient assessment and summarises the conversation. Once the clinician has verified and confirmed the summary, it is seamlessly uploaded directly into the patient's record within the Rio system. Next, we'll take a look at the individual patient sessions. Here, Copilot within Access Evo offers summaries of patient records. As our clinician navigates the hospital, they have the reassurance that their Rio Reimagined mobile applications have offline capabilities for areas with poor Wi-Fi connectivity. All Evo-enabled products are accessible in one place, requiring just one login, allowing all clinicians to quickly launch additional products as needed throughout their appointments. During the clinician's lunch break, we highlight the range of software provided by the Access Group, all integrated within the Access Evo experience. Access Evo users can also utilise non-clinical software modules such as Access Early Pay, which facilitates salary drawdown for unexpected costs. Additionally, they can submit an annual leave request with just a few simple steps through the Access People Management portfolio. As our clinician transitions to community visits away from the hospital, Access Evo continues to offer rapid access to vital information via the Access Evo app. Copilot serves as a valuable tool in bringing up relevant information from policies and procedures specific to the clinician's current situation. For instance, if a patient exhibits a very high News 2 score, Copilot will promptly highlight the relevant procedure. The Access Rio Observations app is then used to document these observations, uploading the score instantly into the Rio patient record. Upon returning from community visits, our clinician facilitates group therapy sessions. Access Rio Observations is once again used to record any relevant observations, while Access Messenger serves as a means to notify colleagues of any critical information pertaining to specific patients. As the day comes to an end, the clinician dedicates time to their administrative responsibilities. Access Evo Feeds, designed to alert users of changes or updates, notifies the clinician that they have been assigned e-learning related to News 2 scores. They can also track the status of their expense claim after submitting a request for fuel used during community visits. During the team debrief and handover part of the day, clinicians can quickly bring up information on the day's activities and review any urgent updates to hand over. So as you can see, the Access Evo Health suite of software is available in one place and has allowed our clinician to complete both clinical and non-clinical tasks across both desktop and mobile, giving the clinician the freedom to make it personal and focus on their patient's care.
So this is just a snippet of what's possible. Each of you will be thinking, oh, that would have gone in this direction at that point, or how about if it would have been able to do this or that. This is just kind of 6, 7 different moments throughout a potential day, and actually we know there's far more than that, and actually there's far more interactions with the different systems and services that you'll be using throughout those days. But just to begin to get your heads and your minds thinking in that direction, because we're going to explore a little bit later on a little bit more around actually how this can be used in health, and raising some of the questions. But I think for me, I like this one from a kind of ending wrap-up perspective, because I started with saying 25 years in tech, and part of that was, we were talking earlier on the table actually, we were talking about the launch of smartphones, and do you remember when we used to have Blackberries? Do you remember when we had the first colour screens? And I put the first camera into a mobile phone and struggled for 2 years to get anybody to take it, because they were like, nobody's ever going to use a camera in their phone, they will always have a digital camera and their phone. And the world changes, but there are very few moments in time actually from a technology perspective that are so fundamental. Smartphones, internet, search engines, there are a few of them that I can remember throughout my career, but actually at the moment AI and how we use it is a true moment in time that we need to embrace. It's not should we do it, it's how do we do it. And I think as technology providers, us as a group, with our collaboration with Microsoft and others and our partners that are here, alongside yourselves, it's about how do we do that in the right way and how do we make the most benefit out of it. So yeah, without making myself jump, I'll put the click up again. But if there's any questions, feel free to ask.